people might not remember, but I sure do. 8 years ago, pre-COVID, therapy wasn't cool. Mental health wasn't cool. Nobody was talking about it. So COVID happens, and that's the silver lining of COVID is like this mental health discussion we're having right now. And when we talk about like what happened is, okay, floodgates open. Everybody wants mental health. That's horrible and great at the same time because it forced us to be able to figure this out.
Good morning. Hi, everyone. I am Stacy Huston, Executive Director here at SixDegrees.org, and welcome to this very special LinkedIn Live conversation. It's part of our I Get It campaign. Mental Health Awareness Month is here, and we've been highlighting real conversations with leaders and nonprofits across the country who are working to normalize the discussion around mental wellness. And today's conversation is one that I've been personally really looking forward to. We're talking about how to calm. Not just the app, but the mindset, the science, and the habits that help us reset in today's really chaotic world. And I'm thrilled to be joined by Dr. Mosunic, Chief Clinical Officer at Calm, who brings not only a deep knowledge of behavioral health and healthcare innovation, but also just a real passion for helping people feel better in their everyday lives. And I'm so excited to have you here today. Welcome to the show.
Hey, Stacy, so thanks for having me, and thanks for the excellent pronunciation. That's like 1 in a million people getting my last name correct, but I go by Chris anyway, so for today, let's go by Chris, and I can certainly introduce myself in a way that hopefully isn't too belonged, but essentially I'm a clinical psychologist by training, and I started my career way back when because at a macro level, helping people is in my DNA. And my parents were a priest and nun, then they became social workers, and essentially, like, we're helping people. At a micro level, I always thought that mental health would be much stronger in terms of helping people with their physical health. Actually did a little stint at medical school and dropped out when I realized I didn't like going in the side of medicine and trying to change mental health. I wanted to go in the side of therapy, and I wanted to go in the side on that angle and essentially help people stabilize their mental health, which I think leads to all sorts of positive outcomes in life, your mental and your physical. So I think it's a deeper root cause of so many things, especially in chronic conditions. So clinical psychologist, and I started off my career at Yale New Haven Health, and we built an integrated weight loss and diabetes center with that model in mind, and then moved on into private equity and the like over the years. And essentially my last position before coming into the virtual world was leading firefighters at a hospital outside of DC. And essentially the why that came really apparent is the best part about mental health when it's done right is that you save lives, right? You save them and you save people. When you go after the hard stuff, like firefighters or people who don't normally get help, that has a huge impact. And being able to then transition into the digital health world like 6 years ago, which I did with a company called Vita Health and scaled them up, then moved over to Calm 4 years ago, largely because we can do amazing things with wellness. Fantastic. But they asked, the customer base essentially said, hey, Calm, we really like you. We want to do more with mental health. So they brought me in and a bunch of folks from the healthcare world in to scale up, moving more into the mental health world. And we're going after the hardest stuff, right? We're going after the things that like anxiety and depression, those are the two most common, but we're going after that for sure. But we're also going after the tough to reach populations. And that's super fulfilling when you're doing it at scale.
That's one of the parts of the conversation I'm most excited to get into with you today, and we'll get there because you guys are doing it really thoughtfully, intentionally, and I think that's really important. And circling back to your work in working with firefighters, it just so happens that our very first interaction with Calm really came out of a project that we were doing with the International Association of Firefighters, and so I find that to be just kind of a beautiful marriage. And we were really unaware of the high rates of depression, anxiety, and suicide in that population. But the partnership with Calm was so well received, and the feedback, the emails that we received really showed us that we were onto something, and that you guys definitely have a tool that creates an accessibility to wellness that can help break through some of those populations that have the hardest stigma and areas to reach. And so, Calm has become a household name, but not everyone really knows the kind of clinical intent and impact around it. So I'd love for you to share a little bit about your role. I mean, you mentioned how they brought in different clinicians to really scale this to impact, but if you could share a little bit about how that's evolved since you've joined them.
Yeah. So about 3 years ago, there's two parts to it. Essentially, coming into the world of mental health for Calm was a big step, right? So they essentially needed two things. They needed one, okay, a clinician like myself to come in and essentially do that part. But the other part that's so important is the platform, right? Because healthcare, especially in mental health, has to be super secure. You have to have a really amazing platform. And also in mental health, unlike in physical health, mental health is connected in ways that have many things to do with outside, like outside of the professional community, meaning a medical record, like as laborious as they can be, right, serves most of the functions for those physicians, nurses, and the teams. But in mental health, you need a much more robust system to connect your therapist with your physician, with perhaps your caretaker, right? Because being able to connect all the dots in mental health, like mental health doesn't happen in an office, right? Mental health improvements happen in an ecosystem, your ecology, if you will. So we needed a healthcare platform that was super robust. So the two, like the company that spun out of United Healthcare, led by David Coe, he's our CEO now. He essentially had the platform and the team to come in and build that healthcare engine, and I brought in the clinical know-how, and we built a different app called Calm Health, right? And why does that be a different app? Because it's a healthcare app. It's a mental health app, right? So being able to have the compliance, that takes a long time. And also, Stacy, like one of the biggest problems we have in mental health too is it happens in a silo. Meaning, like in the therapist's office, it happens in a black box. Quite often, the therapist is unable to have the time to call up a physician to talk about medications or family members. So it's siloed. And being able to think back on like what we were doing differently is we were investing in interoperability. We were investing because it's the right thing to do, meaning like we wanted to be able to connect our platform with all the other platforms out there in a way that's super easy for like a health plan to get our data, to be able to get, our stuff over to another great mental health company who is further up the continuum. Because one thing when you're at scale in an app, like you're working in the subclinical mild population when you're doing it appropriately. If you start eking into the world of moderate and above in an app, you're in really dangerous territory if you think that's going to help people. And you're actually could be very likely hurting people because they might think it's a substitute for therapy. So we like to refer out. So we created this whole platform, and we've been doing that for 3 years now. And we're live with two health plans, and it's fantastic. But the biggest challenge is getting everybody to understand like what we're all about is like we're people think we have competitors, and it's like no, no, come health, we're not looking at it that way. What we're looking at it is like we want to be part of the ecosystem, that because I inherited this brand like standing on the shoulders of giants, like it's an amazing brand. The founders did that 12 years ago. That allows people to be aware, and they go, "Oh, like, Calm, I want that. I want that free. Oh, my health plan's paying for it? Sweet." Like, that's a barrier usually we have to pay $70, $80 a year, so people go, "Oh, I got Calm for free." Come in, we triage, and then essentially if they're in the subclinical mild, which is most of the population, talking like 70, 80% with their mental health wellness needs, then we have clinical programs, but especially like you said before, like for firefighters, like that's one of my favorite ones that we're about to launch this summer. Why? Because firefighters like have their challenges, but the biggest one is they're a population that don't raise their hand for mental health. For there's this culture, sure, and like that's one, but the other thing is that in certain professions, if you raise your hand, you might get taken off of duty, right? Police, military, like all those types of organizations. So they're afraid and they just don't. So having an anonymous app that essentially like they can get the information specific to them in our clinical programs and be able to help them with their specific issues written by clinicians who know that population. That's the other big part of what we're doing.
Yeah, I mean, that you hit on something that's so important, and I want people to really get that. It's like when we have a primary care doctor and we hurt our foot, they refer us out to an orthopedist, and there's all these different specialists, but a therapist is is usually a specialist in maybe a couple areas. And so if you're working with someone and you find out, oh, they have disordered eating, like you want to be able to get them in front of somebody that really knows this this area very well to get them the help that they need. And I find it to be one of those things that I can't believe it's taken so long for us to kind of start doing these sorts of things. And there's just not a one size fits all with our mental health, much like there's not with our physical health.
Absolutely. Yeah, and that's a big pain point we have in mental health is we're 100 years behind physical health, right? We have specialists in physical health, and we have a national accrediting body that if you're board certified in something in physical medicine, like, okay, orthopedics, you know that essentially if you go to an orthopedist, they're the ones who are going to be able to fix your knee. Super, right? You don't go to your generalist and essentially expect them to like fix your knee. But 100 years ago, you did, right? Like, the same guy who was cutting your hair was also doing that, and their genius was essentially saying, "No, it can't be a generalist model. It has to be a specialist model to get to the highest levels," and they've really done well because at the Fed like, at the governmental level, like, at a crediting body, they've done awesome. We have none of that in mental health, and that's the problem is nobody knows where to look. Like, okay, I've been doing this my whole entire career, my whole life for that matter, right? And if somebody comes and says, "Oh, I have a problem with X, Y, or Z," right? Okay, I can find them, right? And the reason I can find them is because I go, "Oh, yeah, like, I know that school that they went to." Like, for instance, like, a lot of people will think in an Ivy League school are the best clinical psychology schools, and they're good, but if you really want top, like, you go to, like, University of Wisconsin, Minnesota. Minnesota is, like, the most prestigious clinical psych program out there, or one of them. And gotta know that, and then you gotta see where their research is and the quality of their research, and the clinicians, have they seen these patients? So when you want a clinician who specializes in something, it's really arcane to figure that out. And what we're doing at Com Health is like, okay, we find them when we create a program, and that's exciting because they know that population. They've seen the thousands of patients, they can speak to it. And the generalist model is avoided because it kills any we want specificity. We don't wanna go to a therapist who's just says, "Oh, breathe well and, like, be your bestie," right? Because that doesn't make you feel a little better, but it doesn't get you better. Being able to understand the population, what those people go through, like, I think of, like, our nursing program, for instance, right? The first thing we did was, like, find a nursing specialist who treats nurses, and they said, like, none of that stuff works for the most part for nurses. That is the generic stuff. I mean, if you go tell a nurse who's having, like, a lot of anxiety that day to go take a walk in the middle of a shift, you lost that. I mean, they can't do that, right? It's ridiculous.
My
Yeah.
parents are both nurses, so they would laugh at that.
They would laugh at that. Exactly. Yeah.
The lived experience piece is really critical, and I mean, we're kind of getting into the barriers, right? Because I think that one of the things that we're seeing in our work in the nonprofit space is people wanting to help, but, like, how do we get people access to these things? And access is still a really major barrier, and a lot of organizations that are trying to, provide therapies are fundraising simultaneously, and in this campaign, if I get it, what we've learned is that there's just not enough providers. It's pretty stark, but you've touched on something a couple times about how most people that are seeing therapists or have something diagnosed, there are kind of in that mild to moderate, phase of mental health needs. And so, how can companies like Calm really help in that area in terms of closing the gap and helping almost triage those that need support in a more mild way and then make more space for those that have severe mental health issues or in a current crisis to be able to have access to the clinicians that are available.
Yeah, it's a great question. We've been trying to figure it out now for about 7 years. People might not remember, but I sure do. 8 years ago, pre-COVID, Therapy wasn't cool. Mental health wasn't cool. Nobody was talking about it. We were funded as nonprofit parts of the hospitals for the most part, treated as such. Our offices are in the basement at best, right? So COVID happens, and that's the silver lining of COVID is like this mental health discussion we're having right now. And when we talk about like what happened is okay, floodgates opened. Everybody wants mental health. That's horrible and great at the same time because it forced us to be able to figure this out. And the one thing that became really clear is that when it comes to mental health, the guidelines are like rock solid and have been for some time. If you score on like a screening measure, like the PHQ for depression or the GAD for anxiety in that mild level, and when I say mild, I'm not talking about like colloquial mild, I'm talking about like clinically mild. It means you're suffering, meaning mild is not like, oh, I have just a little bit of anxiety. It's like, no, my life is really debilitated by this anxiety. It stinks, right? If you're in the moderate, you're hardly functioning compared with what you normally could be. And if you're in severe, you're out for the count, right? So when we talk about mild, moderate, and severe, the majority of people coming into therapy are in that mild bucket, right? And the tools in that can be utilized for that mild bucket are in a gray zone, right? So you don't necessarily need therapy in the mild bucket to get better. So we tried, and a lot of organizations successfully over the years, and some unsuccessfully, have tried to use coaching in that model, right? And some coaches, great, work really well, some don't. And the reason being is that it's really hard to get a quality control with coaching organizations because similar to mental health, the coaching world doesn't have just one body that controls everything and can certify with this is good, this is bad. They're trying, but they're struggling just like mental health. So that mild bucket is the biggest bucket where the majority of the population's mental health needs are. And then being able to say, okay, we're writing programs like the best therapist in the world would essentially like be talking to you about your mild level conditions, right? But let me backtrack. Unlike like what the best therapists are in the world, people think have the wrong stereotype of the best therapists in the world. I think of more like if you've seen Shrinking, like Harrison Ford is probably the best depiction of an amazing therapist, right? Like a little curmudgeon but basically no BS, like pushes you to go hard, and that's more accurate, right? That's much more accurate. What's not accurate is like thinking of more like a gentle guided meditation helping you. That's not therapy, right? Therapy's hard work. But the problem is when you're trying to translate a clinician talking like myself, we're not good at that. It's not engaging. We're super like not that way, right? I mean, there's a few unicorns. Like we work with Julie Smith. She's the biggest psychologist on TikTok. She's amazing. But other than her, like most of us clinicians had any interesting parts of us like destroyed long time ago, right? And because like you get up and you're like, just the facts. That's all you're allowed to say as a clinician. Use science. And then that doesn't engage people. You gotta have the entertainment part. Like, that's our bar. If we're on phones right now, if you're in a phone and you open it up and a clinician starts going, about to talk about a program, he goes, and then starts talking, you're gone before the breath even comes out, right? But you work with somebody like, Kevin Bacon or something like that, right? It's like he comes in and he just knows exactly what to say. And so we have those Hollywood narrators deliver the scripts because that's what makes the difference is that they're put in a way that's colloquial, that essentially is engaging and comes with the right like narrator to essentially pull you in because you got to have that engagement part, but you got to have the science behind it to really help push the person and help them push themselves to get better. Because in therapy, we have a quality problem, and a lot of times people go to therapy and they don't get better.
Mhm. Yeah, no, I've big proponent of therapy, and I've had some therapists that I'm like, I have to fire you,
Yeah.
and but it took me a long time to even get to that point
Mhm.
because when you start seeing a therapist, you have to get through like the background information, right? And that almost feels like a little bit of a hill. You're like, well, I've already gone through several sessions where now they've got up to speed on my life, so let's just see if we can make this work. And it can be hard, but it's one of those things that you do want to find someone that's the right fit if you can. And so sometimes it's like dating and you're trying people out. And if you have anyone listening, if you've never done therapy and the first therapist you work with, you're just like, I do not like this, then that's fine. And just know that not every therapist is the same. And you can find someone that you click with just like any other relationship. And at SixDegrees.org, we are really focused on human connection. We don't believe it can be replaced. We believe it's really important in building community, but also helping people to fight these feelings of isolation and the loneliness epidemic that we've been talking about the last couple of years. I just read the World Happiness Report that just came out last month, and they said 1 in 4 Americans ate every single meal alone last year. And I find that to be heartbreaking. Like 25% of people are just walking around not having any communication all day long when they're sitting at a meal, which is typically our time to take a break, right? And have some community. And so that on top of, we have antidotes all day long, right? We can see what's happening, but in your perspective and what you're seeing at Calm, what's the data really saying in terms of where our mental health crisis are worsening or improving? Like I think that we can feel like it's getting worse all the time, but is there some reason for being hopeful? Or is there some things that we need to be cautioned to in the next, 3 to 5 years?
Yeah, I'd be remiss to say that comms data is the best data. The best data that's coming out was published back in JAMA, a Journal of the Medical Association, back around the turn of the year. And they showed distinctively that the trends on mental health treatment, telehealth especially, because that's the biggest venue that people are getting their mental health services at this point. It's good news, people are getting more therapy. Bad news, the populations that need it the most are not getting more therapy. So that's a huge problem. So I think like what it showed is like, okay, middle class and above, like white people with females most likely to essentially engage in more therapy. Great. They have needs. That's good. Black children, less likely to engage in therapy. I'm like, that's a huge problem, right? They're underserved already, and now they're even more underserved. So being able to say, okay, like this is happening. The current system isn't able to address it. It's better than it was 8 years ago because telehealth is here to stay in mental health, no doubt about it, forever. And being able to get better quality, like you said before, Stacy, like don't be afraid to leave a therapist. Like, yeah, heck yeah, right? And the best companies right now are able to say, oh, let's right from the get-go measure the connection between a therapist and their patient. And if it's working, like they'll have what's called a strong therapeutic alliance. And if it's not working, they'll have a weak one. And then the therapy company says, hey, like, why don't you try somebody else? Because if you don't have that strong connection with your therapist, it's not likely to work. And then moving over to like the world in general, like with the loneliness points you put there, right? The therapist for many years has served as a bestie or a therapist or both because people are lonely. And that's like we did a program with the former Surgeon General, Vivek Murthy. Like he's a wonderful human being who really wanted to target loneliness because he knows that it's the root of, yeah, mental health conditions like depression, no doubt about it. But it also drives like unfortunately like really severe mental health, like physical health consequences. Like in the short term, people will pass. Like my grandparents, for instance, both sets, ironically enough, my grandmother passed and then my grandfather passed within 3 months on both sides. And they were pretty old, but it just like that. And the loneliness we know is what drives it. And being able to cure that loneliness, right? That is something that like our CEO, Dave, and I were like actually brainstorming over like the weekend. Like, what do you do for someone who's coming from a culture who they are isolated? Like, and it's not okay to ask for help, right? And they're going to suffer, but they're not a therapy generation like the people in their 20s at this point, right? Those are the things we're really trying to attack because it's hard and they won't go to a therapist for the most part. But how do you get them to the mental health needs you have? And we think it's just like the answer, it becomes really simple. Like simply like what you're doing, Stacey, and what we're doing is that there's no one solution. It's working with lots of people who want to be good players in the mental health space who essentially want to help people and do the right thing and finding those folks and referring to each other and giving them resources and making it easy for them to get there versus having to, go the traditional healthcare route and try and find someone in a ghost network and all that other stuff. We know that's not working.
Yeah, the cultural stigmas can really play a big part, and we don't believe we can do anything alone at SixDegrees.org. Everything should be done, we think, collectively with partners as part of why we built the I Get It campaign this month, bringing in, 13 different nonprofits from across the spectrum, across the United States and all of these different areas because there is no one size fits all. And there's oftentimes, we're gonna be dealing with different things at different points in our lives, and so you're right. It's having these conversations, creating, shared resources and continuing to innovate. And I think that is really, really critical
Mhm.
with anything that we're trying to solve, especially these larger issues. Yeah, I was reading, and the U.S. Surgeon General talked about the health impacts of loneliness being compared to smoking 15 cigarettes a day.
Yep.
Like, that is astonishing, but also tells that story, and then you see people that they say, the people that live in blue zones, people that are living the longest, it has less to do with the Mediterranean diet and more to do with how many people they see every day and have direct interactions with. So if that doesn't tell us that community is important, then I don't know what will. So we are obviously in a space where nonprofits, we're in high stress, more and more, especially now. But we work with a lot of different high stress types of industries, and we see them. We're on LinkedIn now. People might be tuning in, feeling that pressure. What's some advice that you could offer in terms of how maybe leaders can support their teams in in this kind of environment that they're in right now, or how individuals can kind of step up and take care of themselves?
I'd say the leaders one is easy, right? It's definitive that if you want to truly help your teams, there's no one solution that's going to work for your whole entire population. It's going to be multiple modes of helping them with their mental health, and even on the continuum of mental health and wellness, right? The preventative aspects of wellness and providing those things for those tools for folks. That's really important because a lot of times you can prevent escalation if you get to an issue early. Like I think of like eating disorders as being like you brought that up before. That's where I started off my career. And like eating disorders is one of the toughest places because a lot of people don't realize that the amount of people who die with an eating disorder is extremely high. And quite often it happens because the treatment that they're receiving isn't appropriate and it wasn't caught early despite the signs being there. So being able to have mental health platforms that really are very good at being able to find things early, that's a great thing to ask about when you're thinking about, oh, if I want to support this population, like how robust is this population? What's your assessment, right? What are you using? But also on the wellness related measures, right? You want them to be integrated into the mental health measures. You want it to be able to be, oh, a person tries out because people will quite often try out wellness related stuff. And what I mean by that is that's how Calm knew to develop Calm Health because what was happening, they started with meditation 12 years ago, quickly discovered that people were having problems with their sleep. No stereotype, but their sleep. You say, oh, I got a problem with my sleep. That's not like saying you have a problem with your depression, right? But, you know, it's like they're quite connected. Anxiety, especially. It's like,
Sort of, kind of the same. They're gonna really relate to one another and
yeah,
probably affect each other, so yeah.
exactly. So that's what happens is, oh, people will be like, oh, I'm not sleeping well. Well, and if you have the right platform in places, like platforms in place, people will try, they go, I'm not sleeping. And then they'll gently hear that might be anxiety. You want to get some help for your anxiety. And people don't just jump in with their mental health. People don't, like, I mean, some people do, but the majority of people, especially like my generation of like and older, Gen X and older, do not just jump into mental health and be like, "I'm depressed." Like, no,
What's out there for me? Yeah, yeah.
yeah, exactly. So they try out things, and that continuum is like really important to have established. Like, people are going to come in from different directions. Of course, you want everything evidence based, but the thing that really makes a difference too is having pragmatic tools, right? Like, so people will talk about calm, like the calm of 12 years ago, and say like, "I don't want to meditate. I don't like calm," and it's like, well, that it's like, I don't wanna meditate either, like, that ain't for me. Like, what I like is I like the sleep stories and calm that evolved out of it, and that's really what most people do because they're very very impactful. And so when you talk about like why Calm has brand trust, why people trust Calm so much, it's because it delivers. So if you try a sleep story, right, just like a therapist, like people are amazed how quickly it conks them out, especially children, like parents of children. When, like, when you're an exhausted parent and you have young children, your version of Moana's sleep story on the 30th time on a Friday night is probably not that strong. You're probably not that good at it. And you're probably going to do a half-baked effort. Um, on the other hand, if you have an amazing Disney character doing the story and making it the kids want to go to bed, that's a game changer for people, right? So being able to have these pragmatic things that work versus like and work quickly and have people coming back, a longitudinal platform integrated with when a person has an acute need, that's the type of stuff you're looking for to create that ecosystem. And then like tips, sure, like when it comes to tips, I'm a New Yorker, right? And like when it comes to being a New Yorker, one of the things you realize when you start going in your training is, oh my God, my whole entire culture is anxious that I grew up in. My shoulders are, and it's not okay to be like, I'm anxious, especially in New York. So one of the things that I think about in like the workplace, especially, is you don't have time to go and do some deep breathing, look at your phone. Sometimes you just have to do stuff in real life. So my favorite go-tos have always been like progressive muscle relaxation that nobody sees. So if I'm feeling stressed right now, I'm not feeling stressed. I'm just feeling pretty happy and activated. Talk with you, Stacy. But if I was, which happens all the time on public speaking events, I would squeeze my fists as hard as I could underneath the table, and then I release them. And when you use your muscles and you tighten them as hard as you can and then release them, nobody has to see that, but it activates the relaxation response and it de-escalates your stress response right away. And it's been around for so many decades at this point, and we know it works. I mean, it even helps to lower your blood glucose. It's when you start relaxing. It's amazing, but it's free. And when something's free, it doesn't get popular anymore. It's like when a drug goes generic, what happened to it again? Like Prozac, amazing drug, helps a lot of people. Why isn't it prescribed all the time? Because it's free basically at this point compared to something. Same thing with progressive muscle relaxation. It works every single time. Squeeze your muscles as hard as you can. Nobody has to see you squeezing your fists if you're on Zoom, or if you can squeeze your thighs or whatever, and then squeeze them as hard as you can and then relax. Your body starts to relax and you get a hold of being able to catch your thoughts and relax a little bit.
Thank you. Thank you for giving us something practical.
Mhm,
We talked about this on an earlier conversation, but someone that I work with, she said, people don't want hard, they want hacks, right?
mhm,
And one of the things that I want to make sure people get from this conversation is that Calm and these tools and resources that are free, like if they were just isolated to one here and one there, like, that's the hack someone's looking for, but when you combine it with the conversations, with, multiple different modalities of support, these different tools, getting you more comfortable and being more aware of what's happening in your body, and taking you towards that step of, "Maybe I do need to speak to someone. Maybe I do need to make a call, make and have an appointment. Maybe I do need to continue to explore this trigger of mine." But then it is hard work, but it's worthy work
uh-huh,
because, I think we think how we are operating today is normal,
mhm,
right? Like, if you've never explored that hack that you just gave us was with your fist and you don't know what it feels like on the other side, then you think it's just, woo woo, that's not really going to work. You don't understand the science behind it.
mhm,
Similar to when I was first starting to speak on stages and I was preparing for my TEDx talk. And I was like, okay, I'm going to make myself really big and I'm going to stretch my arms and I'm going to do this growl. And it sounds really hokey. But guess what? I went from someone afraid to speak in public to not feeling nervous at all in front of 1,700 people. That doesn't just happen with a hack, right? It happens with being mindful of these different tools and how they can really tap into different parts of our biology and physiology and help us feel better. So, um, you've given us a takeaway, and I literally could talk to you all day long when you make jokes about some clinicians being like, "Nah, you're not one of those. You are so fun and clearly deeply passionate about this work. So we thank you so much, Chris, for being with us today and just sharing brilliance and all the incredible work that Calm is doing. They've been such a fantastic partner, and they're a really an example of how partners should show up to support nonprofits and others in their community, especially around mental wellness. So thank you.
Mhm.
And to everyone that's watching, thank you for tuning in. If you want to download our free I Get It resource guide, pointing you to all of these different partners and different areas of mental health, please don't miss out. Please head to 6degrees/. I get it. We will put the link below as well. And Calm is also giving free trials to their app so that you can try it out for yourself. We would love to get one of those in your hands, especially if you find yourself kind of struggling right now. Take that opportunity for yourself, and please remember, healing happens in relationship, not isolation. So let's keep showing up for ourselves and for each other. Thank you so much for being with us all today.
Thanks for having me too, Stacy.